This was kind of like what has led me to all the work that I'm doing now, but he was supposed to be a natural birth. We were at the hospital and it ended in an emergency C-section because we were told that he was in distress and his heart rate was dropping. Yeah. Do you want to come sit by Mom? So we were told that his heart rate was dropping during contractions, and so they basically said, we don't know if the cord is wrapped around his neck, we don't know if the cord is wrapped around his foot, and so it ended in an emergency C-section. I didn't know anything about birthing centers at the time. I didn't really discover them until after I had this like traumatic experience. I just went with, at the time, I just went with the first doctor who would like get me in, because I was like, okay, this is my first time being pregnant. I don't know what I'm supposed to be thinking about. What am I supposed to be doing right now? And we loved our OB. But after that experience, I was like, I need to go somewhere where I know for sure there's going to be a group of people that are going to support what I want out of my birth, instead of, you know, saying they support what I want, and then when it comes to the big day, like, you know, making that decision. I don't know that it would have happened differently if I would have had a different OB, or even if I would have been at a birthing center, but I wanted to just set myself up in a position that was going to be a little bit better for the outcome. And then what I realized was, and kind of what sold me before I even came and toured, which if you tour, obviously that kind of sells it too, but is just how supportive they were, and I wasn't even a patient yet. I called in and I was going on vacation to Jamaica, I think like 2 weeks later, and it was still early in my pregnancy. And I called them and I was asking them just some questions about, is it safe for me to go to this place? Is it, you know, with me being pregnant and Zika and all these other things that I could be concerned about, is this a safe place for me to go? And can you guys check me, or can you get me in earlier? And they were just so supportive of like helping me get to an ultrasound and helping me with questions that the midwives answered, and calling me back and like doing things and moving things around so that I could be seen before I actually left for Jamaica, which was probably earlier than they would typically see anybody anyways. And so I was just so impressed with the care that I was getting, and I hadn't even signed on to work with them. So that was really what like sold me on Origins. And you know, that partnered with like the support and the reviews and everything else that I saw about it, that was just kind of like a perfect fit for me at the time. So one of the things that was really important to us very early on was having a team, a birth team, that was going to be supportive and understand the differences between working with a Black mom and working with any other mom, white mom, Hispanic mom, whatever that may look like. Because our outcomes in the healthcare system when it comes to childbirth is very different. We're dying at higher rates, we're being treated differently in healthcare systems, like our pain levels are not really being considered at the same rate as a white mom. And so that was one of the things that we brought up very early on. And one of our first appointments with Amy is just like what this looks like, and just trying to figure out if they even were aware of it. She totally understood, and she would also respond to us with some of the statistics that we were already aware of. So that made us even more comfortable to be able to have that open conversation with her about the realities of just Black motherhood and Black maternal health, and seeing that not only she understood that, but there were also a lot of other Black moms who get birth here. I want to be pregnant again. I want to have a baby here again because I love the support and the care that I've received. It's been so supportive. They answer all of your questions. They're right there with you along the way. I mean, even though you don't know what you don't know much, you don't feel like that. You just, you know, you kind of feel like these are family members that are just kind of here with you, walking alongside of you. You don't feel judgment, you don't feel shame about not knowing. And yeah, I mean, I would say like I talk to my midwives very frequently through social media and just through texting. And so, yeah, I mean, between all of that and then just different conditions that you might be experiencing throughout pregnancy. And then for me, I was a VBAC candidate. So that was also like, I needed to have people who were going to encourage me along the way and not make me feel nervous, even though it was more of a high-risk pregnancy. Amy, Megan, Origins crew, thank you guys so much for making my birth experience more than what I expected. Thank you for giving me the opportunity to do something that everybody told me that I wasn't able to do. Thank you for giving me Harper in a safe and loving environment and allowing Fitz to be a part of that experience, allowing my husband to be a support system, and allowing our family to have something that we're able to encourage and support and push other people to do in our community who are not typically going in this route, but giving us the opportunity and the experience to share that with everybody else. So we love you. Thank you so much. I hope that I'll be back here in the next few years with another baby that you will deliver. But if I'm not, I'm still here and I love you guys and I want to support you any way that I can.